future of healthcare has arrived. Artificial intelligence and machine learning are transforming the practice of medicine and improving patient outcomes. This is Smarter Healthcare with AI. Conversations with Dr. Hassan Tetteh as he shares insights into the healthcare of tomorrow and how we can help create it today.
I'm back with Dr. Robert Pearl. We've been discussing how AI, like ChatGPT, represents a modern miracle in medicine, with the potential to prevent misdiagnoses, reduce errors, and revolutionize the treatment of chronic diseases. Dr. Pearl forecasts that within 5 years, AI will surpass human doctors in handling complex cases, ushering a new era of smarter, AI-augmented healthcare delivery. He explores this topic in his latest bestseller, ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. So, Dr. Pearl, given your perspective as the former CEO of the Permanente Medical Group, how do you envision AI impacting the broader healthcare ecosystem beyond just the doctor-patient relationship, including payers, insurance companies, medical suppliers, and the overall healthcare industry?
Let me first point out, because I know there's some concern about this too, that I believe that this tool will actually improve the doctor-patient relationship. A lot of concern by clinicians that it's going to erode it. And I say that because it's going to free up the time. Clinicians today are on a treadmill. They're seeing a patient every 17 minutes in the United States. They don't have the time to do the type of conversations that are necessary to have a solid doctor-patient relationship in many cases. It's not to say it's no patients, not to say it's no clinicians, but overall across the United States today, I think it's eroding. And this technology should free up that time. I mean, transferring 20 or 30% of what doctors do in their offices into patients at the home, supported by the tool with other precautions sitting around them. But you're asking a different question, and I'll say an equally important question. And it's why I subtitled the book ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine. Because you're absolutely right. Medicine today is being controlled by for-profit insurers, drug companies, private equity, hospital administrators. And the data on every study that I've seen show that when clinicians lead the way, better outcomes are generated for patients. And the problem has been we haven't had a tool to allow us to do that. Even if you look at other forms of AI, they have to be built by big companies. The big companies aren't going to build them to maximize the clinical care. They didn't. The electronic health record is a great example of that. That's a completely flawed technology that should have allowed at least tens of thousands of lives to be saved by having information available at every place. But instead, the companies manufacturing them refuse to open what's called their APIs, their application programming interfaces, and allow data to be interoperable. So 20 years after the introduction, most patients still, or most clinicians still only have the information from their facility or their office, don't have it from all the other places that are sitting there. So that is why we have to take control. And as I said earlier, why I think it's going to make sense is that this tool not only is trained, but actually functions very similar to how we interact with a resident or maybe with a junior associate. It has the information, it can provide it in a way that is applicable. It can be provided, by the way, at the level of a fully trained world-class surgeon, or it can be provided at the level of someone with a high school education only who's never had an advanced course in biology or in medicine. So it can adjust to whatever the circumstances require us to do. But you're raising two other points, which is that to be successful, we're going to have to change the reimbursement system of medicine. And I think that this is something clinicians are going to have to recognize. At the fee-for-service method of payment, the more you do, the more you get paid. Whether it does any good or not, doesn't really matter, has to shift to a pay-for-value. That we have to be rewarded, not just for reversing heart attacks when they occur, but preventing them in the first place. If this tool does 20 to 30% of what we do in our office in the home, and there's no reimbursement for it, I can tell you clinicians aren't going to use it. They're not going to recommend it. It's going to be just another equivalent of electronic health record. But as soon as you're paid on a prepaid, pay for value, I like the word capitated way, a single payment to take care of a population of patients, good things start happening. Incentives get aligned. Patients don't want to have a heart attack and have it reversed. They don't want to have it in the first place. And when you're paid in a capitated way, taking risk, you have no choice but to work with other clinicians in a collaborative, coordinated way, because that's the only way to achieve the kinds of superior outcomes that are rewarded in a pay-for-value type system. But all of this is still requiring leadership. And that gets you back to the question you posed about the Permanent Day Medical Group. So I was the CEO for 18 years, actually. I was responsible for the medical care of over 5 million individuals on both the West and the East Coast for the people enrolled in Kaiser Permanente. The CEO of the Permanente Medical Group is the Permanente half, the delivery half of Kaiser Permanente, the Kaiser side being insurance and a hospital or running the actual physical hospitals. And so the combination creates an integration of care, and that requires leadership and coordination and negotiation and all the other skills that are needed. And if we're not willing to put in place or demand, actually, a capitated type payment, if not willing to create a leadership structure, then all this is going to fail. And one of the questions I often get is, if this technology is used, won't corporate entities just seize it? And I have two answers to that. The first one is they are going to try to seize it. They're going to seize it whether we help them or not. That's the history of technology. But once they seize it, then that is the system that will be used. So this is our opportunity to be able to do something to actually lead the way. And number two, I want people to understand that if we don't do something, particularly as clinician leaders, what's going to happen is that the problems of today are going to only get worse. According to the federal government, the cost of healthcare is going to rise $3 trillion a year by 2031. Do any listeners really believe the United States can afford $3 trillion more every year for the current healthcare outcomes that we achieve, which, by the way, lag the 12 other most industrialized nations around the world in both life expectancy, in maternal mortality? We have the highest. Childhood mortality, we have the highest. We go down the whole list of ways in which the clinical outcomes are not as good as they need to be. Are we going to spend $3 trillion more dollars? Would it be a lot better to use that money in education or defense or lowering taxes, making life easier for patients? No, I think we have a lot of ways it could be used, and it's not going to happen. And all that's going to happen is we're going to have that pressure. One of the points I often make on this book, because people have asked me the question you said, which is what it's going to take to advance. People, when it comes to a new technology, particularly one with an exponential curve to it, the doubling every year, tend to look at what exists today and say, oh, that's not that significant. And I always try to say, no, pick your head up and look to the future. What's going to happen in 3 years? What are these corporate entities going to do in 3 years? They're going to put more pressure. They're going to lower the reimbursement. We already see Medicare doing that. Last year, it decreased slightly. This year, it's decreasing even more. It's going to happen every year. We see insurers doing the same. So the problems you're raising are existent in healthcare today. We now have an opportunity and a tool, generative AI, to be able to take back that control. And in doing so, I believe, as I said, save the lives of hundreds of thousands of patients with remarkable impact upon families around health and making care more affordable. We have the ability to improve the doctor-patient relationship, reduce burnout, but it's up to us. Whether we see it and our patients or not, that will determine the future of medicine. We are at a unique point in history, the dawn of another era. And if we don't embrace the opportunity now, I'm fearful that we won't have a chance again by the time the corporate entities have taken control and made that the way that medicine is provided in the United States and demanded it of us as the providers of care.
Well, you and I definitely are cut from many of the same cloth. So when you mentioned the value-based care, I spent much time with Roger Porter, Professor Porter, at the Harvard Business School, and thinking about and learning about the 5 forces and the strategy that fix healthcare, and his entire laying out of Michael Porter's laying out of the strategy to fix healthcare, which is value-based, as you mentioned, and has all of those elements that really put the physician leader at the center of much of that fix, and the patient having empowered information so that they can all become participants in the health of the individual. When we think about all of the challenges that you raised, and you also mentioned a reference in the book that we lost control as physicians in the 21st century, or to healthcare, and for all the forces that we just talked about and outlined. Going back to the doctor and the patient relationship, and the ability to use this tool, it's not lost on me, because I've been following trends and looking at many of the things I think you've also observed. Do you think that AI can be used as a tool to sort of bring and deliver care outside of these facilities, these enterprises? I think you've referenced that, but perhaps you can give us a picture of how that may look and what that may look like. For instance, you mentioned that when you come into the doctor's office and you're doing just your typical appointment, you're getting just a snapshot in time, as we all know. And it may be just a snapshot in time, maybe for the whole year, or maybe over just a few months. But while the patient is at home, outside of that facility, outside of that environment where they just come for that one meeting or that one consultation or that one follow-up, all of these other things are impacting their health. They're happening to them. And we have an opportunity to intervene, but we don't know what we should intervene on because we don't have that information. We have a very limited amount of information. And if you look at a patient's record, it's only a very, very small sliver of a capture in time, or a snapshot in time of what's really happening to that person. When you talk about that totality of health, how do you envision, or how would you, share with the audience how this tool, this very powerful tool, generative AI, can take the health and the health care and the surveillance and the ability to deliver good advice and care to patients outside of those facilities, outside of those walls, and beyond, just that one snapshot in time?
What you're describing is a home companion, and that is how I see this tool for all of us. It can be a tool to allow us to live a healthier life. If it's diet, we can have recipes created, shopping lists provided. We can put the information we want. If we happen to have disease, we can make sure it aligns with that, whether it's diabetes that we might have, or hypertension with a necessity to limit the amount of salt that we take. It can have an exercise program. It can connect people. Isolation, as we know, is a major driver of mental health issues. It can serve as that tool for all of us. As we have problems, it can provide information. I often think about the parent who doesn't have a medical background. It's 11 o'clock at night. That child has 102.5, 103 fever. What should they do? Do they go to the emergency room and know they'll wait an hour and be surrounded by people coughing with infectious disease? Do they wait till the morning, but they clicked on Google and they saw it could be meningitis? How do we help them and evaluate that? You call the doctor's office and says, go to the ER. Why does it say that? Because that protects the clinician. But you don't want to just go to the ER. You want to know, do I have to go to the ER? You call the answering services, and the doctor will call you back in the morning. You can't get expertise today. This is going to provide it. It's going to ask questions. Is your child lying there limp, or is he or she riding their bicycle around the living room floor? One way, it should be called 911 right away, and we'll notify the ER. Another way, it's going to be go back to sleep, and the doctor will call you in the morning. So there's opportunity to be able to manage a lot of the musculoskeletal problems that we have can be well managed without having to see a clinician. At the same time, as I said in the story earlier about the woman whose husband fell skiing, we don't want to dismiss major problems. And this technology will have, not today, again, I want to make that point again, but as it becomes exponentially more powerful, to do that, to educate people, not just to provide information, but to provide actual expertise. But as problems get more severe, this tool becomes more powerful. We discussed earlier about chronic disease, the opportunity to not only to measure and to evaluate what's going on, but to be able to feed it back on a continual basis. If you look at the programs that exist today, Look at the information coming off of an Apple Watch. You can't do anything with it. You've got to send it somewhere. You're not going to send it every day to doctors and nurses to evaluate it. This tool, generative AI, can evaluate that for you. That's why I think we're going to see this tool getting embedded inside all the applications that we had relied on before for information, for data, but not actually for that expertise. So as you have chronic diseases and you can start to wear monitors, it will tell you how you're doing. So you'll have a snapshot. It's not going to be overburdening, but it will be able to either reassure you if that's what you would like to have on a continual basis that things are going well, or warn you when things are not doing so. And when you call the clinician will want that call because it will not be generated just by a random reading off of a machine. It's actually going to be generated by an analysis of what's going on. And I said earlier, when you go to the doctor's office, you'll have expertise and knowledge about what's happening. But let's look at another area. Right now, and the data just came out last week, hospital costs account for over 30% of medical care, of the total dollars that we spend annually. What we know is that they went up last year 7.7%. Tremendous rise in the cost of hospital care. And I'll add one piece to it, which is that probably 25, 30% of people admitted to a hospital could be better managed at home without the risk of being kept all night and awake all night and developing delirium, without the risk of a medical error, without the risk of a hospital-acquired infection, which is one of the leading causes of death for people in inpatient facilities. What's the challenge? Why is this hospital at home? It's been well shown that it has the ability to provide better clinical outcomes for patients not done. Well, some patients obviously are too sick and they need to be in an inpatient facility, and some homes don't have the support necessary. There's not a caregiver there who can provide assistance. But a major reason why it is not utilized to the extent that it does is that of knowing what's going on. But a major reason also is that hospital administrators don't like it because it reduces the dollars that they collect. But from a clinical perspective, the opportunity is we don't know what's going on. We don't feel comfortable as clinicians just having you at home without having monitors. Well, now we have the perfect tool to accomplish that. Whether it's wearable monitors or actual bedside monitors, all the things can be done. And a continual ability to know how you as a patient are doing. And again, when there's deviation from that, we can connect you with a doctor or a nurse available with a telemedicine visit who can intervene, answer questions, and make the determination what needs to happen, or identify that an emergency is happening and be able to have you intervene, have the clinician intervene more rapidly. The thing about it, this group of patients is that most of them do very well, 90%, 95%. They don't need anything else except following the advice that the clinician gave them when they left the emergency room. And that's why you can have, I'll call it a leveraged system. A technologist overseeing a large number of patients with a small number of clinicians immediately available. And I want to make one other argument, particularly for the clinicians who might still be concerned about some of this tool. And I want you to recognize how often we don't know what's happening to patients between experiences. Right. The visit in the office is one example. The nurse who makes rounds every 4 hours, what happens in between? And I did a study way back when that if you look at patients who are hospitalized in a medical surgical unit who go on to deteriorate. Now, again, this is not the majority. This is only a minimal number of individuals who go on to deteriorate in their status and have to be transferred to the ICU, the ones who survive the acute episode. What we see is that by several months after discharge, the mortality rate is 4 times higher than the people who you intervene more rapidly. By the time the patient has a cardiac arrest, by the time the blood pressure goes way down, by the time the bleeding has now had a negative impact on the cardiovascular stability, it's too late. We missed the opportunity that's there. And right now, unless you're sitting in an ICU or unless you're on a telemonitoring device, we don't know that it happens. And there's a lot of data that says early intervention will not only save the lives of individuals, but actually, as I say, prevent the long-term higher mortality that happens after the deterioration occurs. These kind of devices can accomplish that for us. And the hospital at home is a great example. We will know immediately when something starts to go wrong. In a hospital, it might be 4 hours before we're able to intervene. We will know when there's a problem in a chronic disease as soon as it's clear that it's happening, rather than waiting 4 months for the next visit. We as clinicians have to recognize how these delays in times, how these gaps in times negatively impact the clinical outcome for our patients. And I believe that once we do that, we're going to embrace this as a tool that is not only going to be more convenient and better for patients, but actually will be far better for us, because it will allow us to have a greater confidence and then be able to intervene with better clinical outcomes in those few individuals who require it.
So as we look toward the future of embracing this technology, hopefully for those that have listened, they feel a lot more confident that there is a tool out there that's going to help improve our healthcare enterprise, our healthcare system, the doctor-patient relationship, empower patients with information. When you think about the future and how the technology will evolve and become even better, what brings you optimism, and how do you impart and share your view about this technology and this new world of healthcare with AI to your students at Stanford and those that you regularly inform and teach, because you're still doing that all the time?
Yeah, I teach at the Stanford Medical School and Business School. There is no challenge or problem getting optimism in them, enthusiasm in them. They're all over it. They want to know, how do we move this faster and faster and faster? They can see it. It's a technology. They're very tech savvy. They've grown up with it. To them, they can't understand why we tolerate the things that we tolerate, why we exchange vital information with other clinicians using a fax machine, an 1834 invention. They can't understand why we tolerate the EHR that exists today. They don't know why we don't use applications on our phone and use generative AI. So getting their enthusiasm is not the hard part that exists. So when I look at the technology, my optimism is very clear. It's the technology itself. And again, as I say, it's the doubling of technology, the exponential growth. As our human mind can't grasp what that means. I often use the analogy of a lake with lily pads on it, lily plants on it, little green plants. If the number of plants on a lake go from 2 to 4 in a day, or 4 to 8 in a day, we look at it and say that's insignificant. That's exactly what's going to happen on the last day when half of the lake goes to fully covered. The difference between 2 to 4, 4 to 8, and half a lake to an entire lake is exactly the same. They all happen in one day. We just can't imagine that. That is coming, and I don't see anything really getting in the way. Of course, there's lots of hurdles. We got to deal with the chips. NVIDIA, the manufacturer, has trouble keeping up. We've got to deal with energy concerns. We certainly have to deal with the hallucinations. But this is the kind of these are the kind of problems that companies like OpenAI, like Microsoft, are very capable, Google, are very capable of overcoming. So I actually don't have any doubt about the technology. I'm very optimistic about it. If I have concerns, it's about the humans. I have concerns that we are going to continue to rely on fee-for-service rather than moving to a capitated system, not because it really is better, but because we're used to it. That's often how human minds work, that we are going to not be willing to take the risk. There's always a risk involved in capitation. The rewards are far greater, particularly for individuals and groups of individuals who do a good job. But that's not the way the human mind works. We overvalue loss over potential gain. So that's one concern that I have. I'm worried that we don't have the leadership. I'm not seeing it in American medicine today. I'm not seeing visionary leaders embracing change. I'm seeing people making cautious investments, finding ways to generate revenue by linking up with private equity, finding ways to be successful by consolidating marketplaces. I see a lot of ways of people figuring out how can we build more for the same services, but I'm not seeing the kind of visionary approach that you and I both believe in around a value-based healthcare system. When people say, what's the best way to make care more affordable? We often think about some type of shrinkage, some kind of limitation on care provision. And I say the best way is to keep people healthy.
Absolutely. You and I know it's costs a lot less to take care of people and prevent disease than it does to do a heart transplant. I love doing heart transplants. I love doing lung transplants. But the cost of that, I mean, we could take care of millions of people and prevent them from ever having to need, that type of therapy. So I agree.
One last piece is that I think there's some fear out there that doctors would be replaced by machines or nurses would be replaced by machines. That's not what's going to happen. We have a shortage. We don't have enough clinicians. Okay. 71,000 physicians left the specialty. We know we'll be 100,000 doctors short. We shouldn't be worried about being replaced by a machine. We should figure out how are we going to use technology in a way that's going to make our professional and personal lives viable. And then to recognize that to do that, we need a different reimbursement system. We need a leadership structure. We finally have the tool to accomplish it. Now, this is my third book. The first one was about the errors in the system of medicine. And I expected that once I pointed out that we were a 19th century cottage industry, fragmented with doctors scattered across communities, unconnected with each other, paid on a piecemeal basis, the fee-for-service, using outdated technology like the fax machine, that change would happen immediately. And nothing occurred. And so I wrote my second book about the culture of medicine because I could see that standing in the way, the things we learn in medical school and residencies about the best way to provide care that were accurate when we learned them 20 years ago, but they're no longer accurate today. And again, little change as a result. And when I asked myself the question, why? That's the question I always ask myself. When the right thing doesn't happen, I want to know why. What's standing in the way? I think it was we never had the tool. We had the great tools for the 20th century. We had the great tools to take care of appendicitis through a surgery or pneumonia through a antibiotic, or to be able to manage a heart attack, whether it was through surgery or whether it was through cardiology. We had tools to do those things, but we never had the tool to be able to make the care, I'll say, affordable, make the care convenient, make the care patient satisfying. And the consequence of all of that was that we see 60% of doctors burned out today. I don't worry very much about what happens to the medical profession if we do this. I'm very concerned about the tragedy that I predict will happen if we fail to embrace it. And as you pointed out so well earlier, allow the corporate entities to continue to drive medical care, to continue to determine the doctor-patient relationship, and in the end, to end up compromising and skimping on care, driven by the fact that as a nation, we simply can't afford $3 trillion more by 2031.
Well, Dr. Pearl, I can't thank you enough for spending the time with us and our audience and for imparting your great wisdom and giving us the pathway, absolutely a pathway to achieving this great state of better healthcare as you defined, smarter healthcare with AI, if I may be so bold to say that. You have outlined how we can take this tool, like any great tool, with good leadership, do great things. You can have a tool like a hammer, and with that hammer, you can build a doghouse. But if you have the right tool and that hammer and great leadership, you can build a cathedral. And I hope that that's what we're going to do. I hope people are inspired by your words. I hope that they seek you out. I hope that you continue to go out and evangelize and spread this good news to everyone, because I think people need to hear it. And hopefully it inspires leaders. And I'm so happy to know that you are teaching the next generation of business and medical leaders so that they will embrace this value-based proposition for America so that we can all live healthier lives in the future. And I can't thank you again so much. Full of gratitude for you spending the time with us.
If anyone wants more information, they get it on my website, robertpearlmd.com. I hope they can all buy ChatGPT MD with the profits going to Doctors Without Borders, a great organization. Absolutely. If listeners think there's errors, think there's problems, disagree, I want to hear from them after they read the book. What are they? I do believe that it will take all of us together to achieve success, but together we can, once again, make American medicine the best in the world. Thank you for having me today.
You're welcome. And that's going to do it for this episode. Please make sure to leave a 5-star review on Apple or Spotify, and don't forget to hit subscribe so you won't miss any future episodes. Thanks again for listening, and I'll see you next time.
This has been Smarter Healthcare with AI. If you'd like to find out how to bridge the gap between medical experts and tech innovators and discover how AI can make us healthier and more human, go to Tetteh.com. Smarter Healthcare with AI with Dr. Hassan Tetteh. is a production of Forbes Books.